All right, so these are the rubrics.
Hi, my name is Grace, and I'll be taking care of you today. I'm a student nurse at Clemson University, so I'm just going to wash my hands and we'll get started, okay?
Okay. Nice to meet you.
Okay. Can you tell me your name and date of birth, please?
Claire Wagner, date of birth is 7/15/1995.
Okay, perfect. I'm just going to close these, and that way we'll get started. Is it okay?
Yeah.
So today I will be performing a head-to-toe assessment, and I will be recording my findings out loud for my professor, so just let me know if you have any questions.
Okay.
Okay, I'm going to start with your blood pressure.
Okay. Do you need me to move my sleeve up?
Yes, please.
Is that good?
Yes, that's perfect. Turn this way.
Mm-hmm.
All right, so just go ahead and relax your arm down the leg for me. Okay, so your blood pressure is about 118/72.
Is that good?
Yeah, it's normal. It's within the normal range.
Okay.
Okay, so now I'm just going to take your pulse for 30 seconds.
Okay.
I'll just use this one. Okay, so your pulse is about 60 beats per minute, and your respirations are about 12 respirations per minute, and your pulse is 2+ and strong, and no abnormal rhythms or easily occluded. Okay?
Okay.
So now we are going to do the abdominal exam, so I'm just going to have you lay back for me. Okay, so starting with inspection, the abdomen, I'm just going to lift this up if that's okay. Starting with the abdomen, it is flat, contour, no visible pulsations or visible bowel movements, and no hernias are present. So now what I would do is auscultate all 4 quadrants for a minute each to assess bowel sounds, and normal findings would be 50 to 30 movements per minute, and that would be considered active. Okay, so now I'm just going to percuss your abdomen to listen for sounds.
Okay.
Okay, so the main abdomen sounds are tympany and dullness is heard over the liver and the spleen. So now I'm going to ask you to sit up for me and pull this down. Just sit up, and I'm going to blunt percuss your kidneys in the back.
Okay.
So let me know if this indicates any pain.
Okay.
Any pain?
Nope.
Okay. Tenderness would indicate a potential kidney infection, but findings are normal. Okay, so now I'm gonna have you lie back down again, and I'm going to start with light palpation, and I'm going to test for masses or any tenderness within your abdomen. Is this causing you any pain?
Mm-mm.
Okay. Now I'm going to move on to deep palpation to test for any deeper masses or just any fluid and rigidity. Any pain?
Mm-mm.
Okay, so abdomen is soft, not rigid, all findings normal. So I'm going to press down on your left side here. Let me know if you feel any pain on your right side down here.
Okay.
Any pain?
No.
Okay, so normal findings and there's no indication of appendicitis. So now we are going to move on to the thorax and lung assessment. So you can go ahead and sit up again for me. Starting with inspection, no barrel chest present. Respirations are normal, chest rises bilaterally, and there's no indication of any accessory muscles that are being used. Okay, so now I'm going to auscultate and listen to your lungs, so just relax and take a few deep breaths in for me as I move around.
Okay.
Okay, thank you.
Mhm.
So bronchial sounds are heard over your trachea, and bronchovesicular sounds are heard over your bronchus and your scapulae, and vesicular sounds are heard over your periphery lungs. So everything appears to be normal.
Great.
Okay, so now I'm going to move on to the cardiovascular exam. So what I'm going to start with is I'm just going to test some of your pulses and make sure that everything's equal bilaterally. So if you wouldn't mind, you can just relax, and I'm just going to assess. Okay. Hand me your wrist. Okay, all pulses are equal bilaterally and are 2+ in strength. Okay, so now just looking at your legs, it doesn't look like there's any swelling. Have you noticed any swelling the past few days or anything, few weeks? Okay,
No.
so no peripheral edema is evident. Okay, so now I'm going to auscultate your heart sound, so you can go ahead and lay back down again for me.
Okay.
And I'm just going to lift this up. So starting to auscultate, we want to find the sternal angle, which will help us to find the second rib, so that we can start with our landmarks and start auscultating from there. Okay, all sounds appear to be normal and are strong, and no indication of heart murmurs. So now I'm going to locate your apical pulse, which is right below here, and what I would do is I would listen to this pulse for 60 seconds to make sure that there's no abnormalities and no heart murmurs. And now I'm going to listen to your carotid arteries. So carotid arteries are not easily occluded, and blood flow is strong, and no bruits are found. Okay, so now I'm going to assess your eyes, so you can go ahead and sit up for me. And just hang your legs down. Okay, so. Sorry. Alright, so what I'm going to have you do is just look straight at me. Okay. Perfect. Okay, and so now just look at the wall behind me over here first. And then when I tell you to, look in at the tip of this pen. Okay, so ready? Now look. Perfect. Okay, so pupils are equal, round, reactive to light, and accommodation. So now I'm going to test some of your lymph nodes. So just relax, and I'm just going to feel around a little bit. So your periauricular lymph nodes are the front of your ears, and they appear normal. Post-auricular behind your ears, and those appear normal as well. And then occipital are down a little bit, and tonsillar are towards the back of the neck, near where the tonsils are located in the throat. Submandibular are underneath the mandible jaw, and then the submental is underneath the chin here. And all lymph nodes, did you feel any pain or tenderness with those? Okay, so all lymph nodes are normal and not easily palpable, which is normal. Okay, so now what I'm going to have you do is stand up for me, and you can step over here. I'm just going to have you walk from heel to toe, just from here to the bathroom.
Over here?
Yes. Okay. And now on the way back, just walk on your heels. Okay. And then one more time, I'm just going to have you walk on your toes. Perfect. Okay, posture and gait appear normal with no high risk of falling. Okay, you can come back over here now. Okay, so now what I'm going to have you do is your internal and external rotation of your shoulders. So I just want you to stand here and move your shoulders up here behind your head. Okay. Or move your arms.
And at any speed?
Yes.
Okay.
Perfect. Do you feel any pain with that?
No.
Okay, so now I'm going to test your external rotation, just have you bring them up here behind your back.
Okay.
Any pain with that? Perfect. Okay, so range of motion is about 90 degrees for each. So now what I'm going to have you do is you can lay down again, and I'm going to test your abduction and adduction of your hips.
Okay.
So I'm going to start with abduction and just kind of pull your leg away from your body.
Okay.
Any pain there? Okay, and now I'm going to do adduction and move it towards your body.
Okay.
Any pain there?
No.
Okay, I'm going to do the same thing with your other leg. Abduction away from the body. Any pain there? Okay. And abduction towards the body. Any pain? Okay, perfect. So both range of motions, abduction is about 45 degrees away from the body, and adduction is about 30 degrees towards the midline of the body. Okay, so now I'm just going to have you sit up again. So what I'm going to do is you stick your arms out for me, and I'm just going to push down, and you push back up against me. Don't let me push your arms down. Okay, ready? Okay, perfect. And now opposite way. Ready? Good. Okay, same thing with your knees now. So I'm going to push down, and you push up at the same time. Perfect. Okay. And now this way. Perfect. Okay.
Well, it's hard.
Yeah, that one's difficult. Muscle strength is 5 with no problems moving against gravity or against resistance. Okay, so now the last thing I'm going to do is assess some of your nerves. So you do me a favor and just clench your jaw, and I'm just going to palpate and make sure everything feels normal. Okay, so just clench your teeth. Perfect. Any pain there with that? Okay, that is normal for your trigeminal nerve. Now I'm going to do your acoustic nerve. So what I'm going to have you do is, if you could sit on that end of the bed for me. Perfect. And I'm just going to place this on your head, and just let me know how you hear the sounds, if it's stronger in one ear, stronger in the other, or if it's equal in both.
Okay.
Okay, ready? Equal in both?
Yeah.
Okay, perfect. So same thing I'm going to do now. What I'm going to do is I'm going to hit the tuning fork again, and I'm going to place it back here. You let me know when you stop hearing it back there, and then I'm going to move it to the front, and you let me know if you can still hear it.
Okay.
Okay?
Okay, I can't hear it.
Can you hear it? Okay, I'm going to do it one more time. Okay, perfect. So this indicates that air conduction is greater than bone conduction in hearing. Okay, so the last one I'm gonna do is your spinal accessory nerve. So what I'm gonna do is just, I'm gonna push down on your shoulders and you just push back up against me.
Okay.
Ready? Go. Perfect. Okay, so now turn your head that way and then push against my hand. Okay, same thing, facing that way. Push against my hand. Perfect. Okay, any pain with any of those? Okay, so spinal accessory nerve appears to be normal. And the last thing I'm gonna do is test a couple of your reflexes. So I'm gonna start with your triceps, so just bend your arm like this. So I just ask that you just keep your arm relaxed here and just let it
Okay.
hang. Okay. Okay. So that would be your the triceps reflex, and normal would be 2+ with no clonus. So now I'm going to test your patellar reflex.
Okay.
So just relax and I'll just. So your patellar reflex would be 2+ normally, and everything would be what? Okay, would be normal, and usually that would kick out, but
But my reflexes are terrible.
it's okay. Okay, so that concludes our assessment for the day. Do you have any questions for me?
No.
Okay, thank you.
Thank you.
I'm just going to show the rubric one more time just to indicate that